Hi, and good afternoon. Welcome to today's webinar. I'm Phil Schaefer, Regional Director with the American College of Healthcare Executives National Office. Before we get started, I'd like to go over a few items. For the purposes of noise control, your lines will be muted during the duration of the session unless there's an active discussion at the end, at which point you can mute yourself to talk. You also have the opportunity to submit questions throughout the discussion in the chat panel, so please feel free to do so. Today's session is worth 1.5 hours of face-to-face education credit. To ensure your credit is applied, please be sure that you're using the Zoom platform on a computer or the Zoom app on a smartphone or tablet. Also, be sure that the name that you're using for your Zoom session matches the name of your registration. Also, please be sure to complete the evaluation for this session. The evaluation link will be posted in the chat box soon. This session is being recorded and will be available within 2 business days. And with that, I'd like to introduce Dr. Nick Edwardson. Nick, I'll turn it over to you.
Thanks, Phil. Hi, everyone. Welcome to the inaugural NMHE SAHA web panel series. I know a couple of you I'm happy to see some faces. I know we're having some login issues. There are these initial Jurassic Park-like initial pains that we're all going through. Thank you for all sticking this out today. Welcome. I don't want to spend too much time belaboring the point, but I do want to just thank the panel that's here today, and Angelica Brunke, for programming, responsible for NMHE, partnering with the SAHA officers. I want to thank you all as well. And to let you all know, we hope this is the first of many panels that are joint between NMHE and SAHA. But without any further ado, let's get into introductions for today's panel. A brief update on the outline of today's format. We will be hearing from Jamie Silva-Steele for the first probably 45 to 60 minutes. Then we'll open it up to a panel discussion where we'll also have Stetson join us. But along the way, Jamie has asked, please feel free to interrupt with questions, either in the chat or send me or Stetson a text message as well, but we'll try to interject politely to Jamie to get those questions in on time. And please pepper us with as many as you'd like. Without further ado then, I've got a brief bio here to read to introduce for those of you who do not already know Jamie and Stetson. Jamie has over 35 years of progressive experience in academic healthcare environment. After earning a BSN from UNM, she began her career as a pediatric nurse and worked in the general and subacute nursing units at UNMH. As her career progressed, she obtained her master's in business from University of Phoenix and moved into leadership roles within the organization, taking on director positions and serving as an administrator for ambulatory services at UNMH. In 2013, she joined UNM Sandoval Regional Medical Center as its interim chief operating officer and has been serving as president and CEO since 2014. Ms. Silva-Steele was a National Association of Public Hospitals Fellow from 2011 to 2012, now known as America's Essential Hospitals. She participated in the Disparities Leadership Program through the Disparity Solution Center of Mass Gen from 2009 to 2010, and was a recipient of the Disparities Leadership Program Award for recognition of excellence in addressing racial and ethnic disparities in healthcare. In addition, in 2014, she received the Governor's New Mexico Distinguished Public Service Award for her work in addressing disparities in healthcare while serving at UNM Hospital. Ms. Silva-Steele is board certified as a fellow of the American College of Healthcare Executives. She served on the Hospital Services Corporation Board of Directors since 2014, the New Mexico Hospital Association Board of Directors since 2015, and of course, last but certainly not least, the most important, the New Mexico Healthcare Executive Board of Directors since 2016. Our other panelist today is Stetson Berg. Stetson is the interim director at the Center for Telehealth for the UNM Health System. He's pursued telehealth as a way he can give back while combining his unique combination of talents, of working with others, love of technology, and creativity to lead innovations that meet healthcare's challenges. Stetson earned his MHA from UNM. Prior to his MHA, he earned his BA in counseling psychology with a focus on addiction treatment and a minor in human development and family relations. He has a diverse background of professional and volunteer experiences. I can attest to this. His information technology skills have led him to maintain servers pharmacy robots, EHR software, and end-user systems for large companies such as Apple, Best Buy, and UNMH. Using soft skills, Stetson has been a cognitive enhancement and substance abuse therapist, serving New Mexico's most vulnerable individuals at inpatient and outpatient settings. Starting in his undergrad and continuing for the last 11 years, Stetson has trained new volunteers to handle suicide crisis calls for Agora Crisis Center. Finally, he is the vice chair for the New Mexico Telehealth Alliance and currently is the treasurer for the New Mexico chapter for HCAHPS. So with that, Jamie, we are looking at your slides here. Take it away.
Okay, wonderful. Thank you, Dr. Edwardson, and also Stetson and Angelica and Bill. Thank you so much. Happy to be here today. I won't spend a lot of time talking about who I am. You just heard that, and thank you for that introduction. But just today we're going to walk through a strategy that I've worked on here at SRMC at our organization since I joined as Chief Operating Officer. And just want to upfront say that the topic of sustainability of healthcare obviously has been very challenged in this last year, given COVID and all the various things that have impacted us. So I'm going to talk through what we have used as an infrastructure, and then to talk also through the challenges that we did see during COVID, but how we've been able to sustain infrastructure and foundation that was established way back at the very beginning. So I'll go ahead and get started. And as Phil indicated, please feel free to interrupt me, chat in the chat. I'll try to stay tuned to that as well. So you heard in my history that I did a lot of my work in ambulatory services. And during that time from 1999 through 2013, I was introduced to the concepts of lean, and a lot of what we know lean as is tools for rapid improvement events and various other tool-based strategies, which are definitely part of the toolbox that I think one needs as in management. When I came to SRMC as an interim COO, first, it was the first time I'd been in that role. I soon became the interim CEO, and I really tapped on my resources that I'd had to understand, how do I kind of set up an infrastructure for management within the organization? And that was mainly my principle. I leaned on a coach that I had worked with in the early years back at UNM Hospital, and met with that person. And literally the napkin there is we met at an Applebee's and we talked about a strategy and wrote on the napkin and said, this is what we need to do first, Jamie, and this is how you're going to kind of get organized around a management system. And I was introduced to some concepts around, again, furthering the lean model, but it more into a lean management type of strategy, which I'm going to walk through. Formally, we introduced an organization known as Institute for Enterprise Excellence. They've worked with us for over the 3-year time frame to help us deploy this structure within our organization, which I'm going to speak through. So the first thing, as with any class, is, so what does sustainability mean? What's the definition? And sustainability, again, I've highlighted the key things that I'm going to thread through this conversation, but it's the ability to be maintained at a certain rate or level. And when we take that one step further and we talk about sustainability in healthcare, that definition is around evaluating systems, building infrastructure and organizational practices, and implementing measures in line with proper budget and planning. What I love about this definition is it talks about the safety for its patients, because that's why we're in healthcare. One is to care for patients, and then also to ensure that we are going to produce results that patients and families feel are the very top notch and the very best for them as far as outcomes. So a key thing that I'm going to tag now into is evaluating systems being a main part of sustainability in healthcare. And so systems, when I think of systems, of course, being a nurse and medical, I think of the human body. The human body has multitude of systems that we have, functioning every day, thank goodness, or we wouldn't be here on this planet. But when you think about the unique system and how that looks within just a regular operating component to the organization. Here it's referencing a railroad system or fluid being pushed through pipes or channels, much like blood being pushed through the organs of the heart and throughout the body. And really developing a system, when you're thinking about it in a work environment, is anchored to developing principles and procedures that ensure that that system is going to be sustained. So that is one of the very main things about developing systems. So again, you can think about, and we'll talk through today, communication system, hiring systems, recognition systems. So there you can start to kind of label everything that we do is a system, and it depends on how complicated it is, but it's definitely influenced by its environment. So everybody in healthcare, for example, has a hiring system, but they don't all work the same way. They don't all give you the same results because there are variations from organization to organization. So one of the things we wanted to also think about is, well, what's the ideal outcome that we want that system to produce? And then how do we make sure that we create an environment in which it is going to be guaranteeing us that result every single day, every single time that we're working within that particular system. Systems thinking, again, something that most folks are aware of, is the process of understanding how systems influence each other as a whole. So example, again, of the hiring system is influenced by systems that are also impinging on that as well. So systems, again, can consist of people and structures and processes that work together. And again, it depends on, is the organization a healthy organization, or is it an organization that is an unhealthy organization? And there are organizations where you have to basically evaluate the fact that this system that you're developing might not work or might work depending on its environment that it's living in. And again, systems thinking is defined as an approach to problem solving. So the management system that I'm going to talk about today is all about raising problems, identifying them, not being afraid to talk about them, making sure that there's a lot of transparency, because in healthcare in particular, problems are in our environment every single minute, every single day, whether it's a patient care problem that's being assessed and dealt with, or it's part of that operational infrastructure, a problem that's occurring at either points that patients are encountering throughout their day. So we're going to talk a little bit more about that as we go. But one of the things that I want to kind of think through as well in systems is there are ways to look at a tool-based approach and then a principle-based approach. And this we're going to dive through because in the management system that we've developed here, we have been focused on a principle-based approach to developing systems. So principles, again, which we'll speak more through, are those things that start to determine, well, what's that culture going to exactly look like? So when you're building culture within an organization, or you're adjusting the environment from unhealthy and trying to get it to healthy, or you already have a healthy environment, you're really trying to look at that culture and understanding how it's going to be sustained. And in sustaining a management system and building a culture, you are doing that on these foundational principles. What within healthcare, as you all know, over the many, many years, we've been told we're not reliable. There have been a number of huge mistakes that have occurred in healthcare. We can all recite those. And most recently, I was struck by the fact that 400,000 people approximately right now today are suffering from med errors that result in deaths. And that's an annual number for the United States. And when I saw that number, I also translated it to what's just been happening with COVID, because we have about 400,000 COVID deaths that have also happened this year. And again, we've heard about, a plane crashing every 2 minutes. I mean, those are very, very visual. But for me, in preparing for this talk today, that 400,000 and knowing that that's what we've seen in COVID also just kind of really, again, struck me and said, this is why we wanted to make sure that we could ensure the care that we're providing produces reliable outcomes for patients, that it's not something that we cannot repeat every single day, every single time. So we're looking at sustainability, and that it's patient change and safety that should really drive why we want to make sure that this system is in place to begin with. So again, you're familiar with the fact that the government's evolving for outcome-based payment strategies. Transparency is at the top of our list, and making sure that then we can start to say, hey, look, we're a very high quality organization, or here's our opportunities for improvement, and this is what we're doing about it. But transparency is going to have to be more and more a part of how we make sure that the public understands, obviously, that they can rely on us as healthcare organizations. So the management system. So again, I've talked about culture. And again, when I think about culture, it's this kind of the centerpiece, this enterprise excellence, what we want to do every single day to make sure that the results that we're providing to patients and to families are trusted, and that they see us as their lifeline. And when they're here, we're taking care of them every single day in the very best way. So our management system basically is broken into kind of three components: what we see, what we do, and how we get results. And so what we see is, the vision of our organization and our purpose, our overall arching purpose, and how we are focused on that purpose really driving everything. And I'll talk more about purpose later on as we go. In what we do, it's how we act. So again, getting to culture and getting to sustainability through the management system, you can get results. You can get the results. You can get any outcome that you want, but you can do it firefighting. You can do it stabbing people in the back. You can do it throwing people under the bus, or you can do it behaving in a way that elevates the principles of the system that you want to have in your organization, to do it as a team, to do it in a collaborative way, to make sure that everybody is on board, understanding where they're headed, and to do it in a way that is transparent within the organization. So results are obviously what we want. And again, it's the culture that starts to define, where do we want to work? Where do we want to be? What environment do we want to be in? And where environment is the patient going to be in receiving those results? So we'll talk more through that in just a bit as well. In organizations, everybody, again, is trying to figure out, so how do I get those great results? How do I get those outcomes? And I mentioned Lean as one of the basic tools that we've used in the past, and we continue to use today throughout our organization as well. But when organizations are looking for results, they will technically and most times bring in a consultant. Not that there's anything wrong with consultants, and consultants are great, definitely for us. And we did the same with developing the management system. But the consultant will bring in this new program, and the new program then results in tools. So you might get new forms, you might get, here's the system we want you to deploy, here's what we want you to do. And then you start to see these results, and everybody's like, all right, there's a party happening and everybody is celebrating. And then pretty soon the consultants leave, and all of a sudden the results are not sustained. So now there's a new program, and there's a new consultant maybe a year from now, and they're bringing in tools. And they are saying, hey, if you just do our method, this might work. And so now we're mesmerized by this new group of people, and we get results and we celebrate and we are excited. But then what happens is the results are not sustained. So our staff, our providers are running scared, because they know right around the corner is another program, the flavor of the month, as we call it. And they are frustrated and become disillusioned because nothing's sticking. And then we show results, and we, if the culture is, well, why is it red and why aren't we getting the result? They're not going to be bringing issues forward. They're not going to be problem solving, and we get kind of stuck in a rut. So again, I'm going to go back to now the tool-based and principle-based strategies. In tools, when you're deploying tools, and again, nothing wrong with consultants, but what happens in an organization is we think, well, it's the consultant's job to deploy it and make it happen and make it stick and do all these, wonderful things. And miraculously, it's going to be in place forever and ever and ever. But management is never bought in, because they are the ones that are owning the tools at first, but our front line is left out. So our front line just receives, here's all the tools you need to do to make patient safety better. Here's what the consultant said, go do it. And the staff are saying, well, okay, that doesn't make sense. That's not going to work in our environment. No one's asked us for input. They become disillusioned. And for sure, the managers are technically also left out of that equation, because it's being pushed from on high. in most situations. And that's how we create this program-based strategy. But in principle-based strategies, what's happening is we're using, again, the behaviors that we want to ensure are part of a culture that's a healthy culture, that ensures sustainability, that ensures good results and good outcomes, and ensuring that those behaviors are tied to the systems that are giving us the reproducible results over and over and over again. So in this situation, in a principle-based infrastructure, the tools are owned by the front line. They're the ones that are saying, this is what we need. If we just had, this form or this tool in the EMR or this thing that was in place, it would change everything. But we don't typically ask our front line in most organizations. That's the last group that gets to give input. We're usually pushing things from above. That when you have the front line own the tools, there is significant behavior change. They obviously feel empowered. They recognize that they're in charge of sustainability. They're the person that is bringing these things forward and helping us put in a system that is driving towards being able to ensure good outcomes, consistent outcomes, sustainable outcomes. And this is how we start to create a philosophy of, again, principle-based structure and system development in organizations. So a couple of comparisons. A typical organization, and we've all probably worked in these, whether they're healthcare or others. Again, the leaders are who are setting the climate. And it's a lot of top down. We also call it white coat management, where, I'm in charge, just do what I say. And it's very a top down driven process. The leaders own the systems. Management sometimes owns the tools. Sometimes leaders own the tools. And the front line is in survival mode. So they're, again, trying to figure out what's the flavor of the month, how are we going to get there. Management in this situation is our most underutilized member of the team that can drive culture, because they're the middle guy or the middle girl. And they're, they're kind of with their hands up saying, well, I don't know. I was just told that we have to do it. And they're trying to push tools out or the program out to the staff. And there's just no sustainability, as we've talked about. In an ideal organization, we introduce the concepts of principles and behaviors, and that's where leaders step in. And that is the only thing leaders own, principles and behaviors, and making sure that those are intact every single day, every single place, every single encounter. The management owns the systems, not the leaders. The front line owns the tools, and everyone owns the results in this situation. And that's how you ensure sustainability. So I'll take you to a graphic that we've also talked about, again, talking about culture and climate, and again, referencing principles, systems, tools, and results. And taking that a step further, when leaders are focused on key behaviors, KBIs, and we're saying, these are the things we want to see every single day in our staff. It's what do we want to see? It's not just show up to work, punch the clock, do the job. We want to actually see things, see behavior. And that's a concept until you really step back and think about it. It's a concept that's not that easy to kind of dissect. In the systems, we're, again, wanting to develop systems that are tied to behaviors. So I mentioned earlier, you can get results by, kind of hell or high water. You can have firefighting. You can have everybody running around like a chicken without their head. But that's not the environment we're going to want. We want an environment that's calm, thoughtful, thinking through problems, escalating issues, being collaborative, and not in that firefighting mode all the time. So systems have to include, how do we want to see that happen? How do we want to see people behave? And these relationships in the environment start then to also sustain the purpose within the organization. And here you see the phrase, putting you first. And I'm going to talk more about that, but that is our purpose statement for SRMC. And in everything that we do, when we get stuck, we might say, how is that putting you first? How is that putting the patient first? How is that putting the provider first, the family, the community? And so when we get stuck, we will come back to purpose always to say, if we're not getting the results, what behaviors are in place, because it's usually behavior driven. Is the system changed? Has it changed? And do we need to tweak it so that we can ensure that we're getting the consistent results? So principles, let's talk a little bit about that. So from the Shingo model, which is also referenced as a lean concept and lean theory, and from the Institute for Enterprise Excellence, there are these principles that are basically defined through that model. And I'll just kind of run through them very quickly first on the right side of the screen. So it's creating value for the patient, a no-brainer, because that's why we're here. Constancy of purpose, meaning, again, how are we putting you first every single day? Meaning that is our anchor. That's what we're focused on. Thinking systemically. So don't just look at dietary when it's impacting all of inpatient and materials management. How do we look at the problem across the entire organization? So those are the principles that leaders, the executive leaders, the top C-suite have to be focused on at all times. They're responsible, and we're responsible for aligning the organization using these three principles. Managers and leaders, the principles that they're focusing on is enabling the people that report to them and the people that work in our organization. The main principles here are leading with humility, respecting every individual, and learning continuously. And so part of the huge shift is managers, and we're all, you're getting your education and being top management leaders. So everybody expects the manager to solve the problem, but we have to turn into the coach. We have to turn into the, what do you think, as our phrase coming out of our mouth. Not answering when we know the answer, letting our team answer. What do they think? Helping them problem solve. And then we've all had situations where somebody may raise a solution and you might not think that is the right thing, but allowing that space for all voices to be heard, so respecting all people. And then creating that environment where it's a good environment, always, escalate, we call it the andon cord, pull the andon cord, raise a problem. We want to know about it. Even if it's not a problem today, it could be a problem tomorrow. Tell us what your concerns are. So that's the manager role, enabling the people. And then frontline are very focused on process, the scientific thinking, so PDSA or some of the other things that we use to look at breaking down problems. How do we make sure value for the customer is always part of the equation? So we can create systems that create value for us as staff and management, but if it's not creating value for our customer, then it's probably a wasted process. So we have to look at that. And then focusing on variation and managing it and making sure that we minimize that as much as possible. So if, Monday, Wednesday, and Friday, we do it this way, and Tuesday and Thursday, we do it this way, we're not going to get the same results, and we're not going to get sustainable results. So we have to think of a Monday through Friday strategy to reduce variation so that it's the same every single time. And then obviously ensuring that quality is the main focal point. Are we getting the quality results? And then being focused on seeking perfection, not being perfect, but seeking to always challenge the status quo. Can we make it better? Can we tweak it? Will it make it more efficient if we did X, Y, Z? So always thinking about that. So align, enable, and improve. I'm going to talk a little bit about that. Aligning is where, again, the leaders are focused on true north. That's what TN means. I'll talk more about that. And it's the strategic compass that we're headed towards. So again, what's our purpose? How do we drive towards that direction? The managers are focused on enabling the people. And again, frontline is how do we improve the process? What we're going to talk through next is, again, little variation to the triangle. And this is basically taking that triangle, if you think of the organization, and now breaking it into work systems. So each of these little triangles are work systems that we have to develop, again, to ensure that we're creating sustainability within the organization. So if you think of all those triangles, and then you think about these principles that I just mentioned, these principles are embedded in every single one of these work systems that we're putting into place. And now, again, we're aligning, we're enabling, and we're focusing on improvement. And I'm showing you there the principles aligned to those particular areas. But if we're focused on, and if we think of this triangle kind of as 3 gas pedals, when we press only on improve, which a lot of organizations do, and they don't focus on align and enable, we're not going to get the sustained results. If you only focus on alignment and improvement and enabling is not happening, you're not going to get results. So it's really about the velocity, and the change comes when all three are being focused on at the same time. So I think of the gas pedal, and you're pressing them at the same pace at the same time. So leaders have to do their part, managers have to do their part, and frontline has to do their part. And we have to understand those various roles that we all have to take on, and that we serve in doing that. And again, anchored to behaviors. So very, very important. So I'm going to now switch us to what does the action plan look like, and how did we get started? So the first thing that we did is we assessed all the areas within the organization. We used this group IEX that came in. We wanted to know, well, so how far off the mark are we? What is our culture? Do we have behaviors that are predominant? How do we do this? Executive team then started to do what we call Gemba rounds. So that's just, rounds within the organization to all the departments to look at that assessment and to understand, so what is happening? We then focused on principles. We took each of those principles and defined what they were and what they were not. So we looked at the counter of the principle as well. And then we said, what does leading with humility look like? What's the behavior? And so we defined those in very, minute details, which you'll see in a minute. And we focused on our purpose of putting you first. That was an effort that we did over a brainstorming day, where we really helped our marketing team came in and helped us look at that. And then we deployed that putting you first strategy throughout the organization. All executives developed standard work, and I'll talk more about that, and where it's literally not just executives, but also leaders and managers have standard work. But we spent almost a year working on this slide, and executives understanding how we create alignment. How do we focus on our three principles, and what are our roles? And then we developed visual boards to look at our results, so that we also created a communication way to communicate with each other. And then a system transformation map. So we also identified the systems that we had to develop to ensure sustainability of our results and within the organization. So Gemba rounds, I use Gemba, that's a Japanese term through traditional lean. And it's really about, the definition is going to seeing the actual place, what is happening. And here, when we went on rounds, what we were looking for is our behaviors being role modeled. How do we role model the right behaviors? How do we show respect for the conversation that's happening? It created a platform for approachability with management and leaders and staff. Here, this is the OR. They're huddled at 6 o'clock in the morning, getting ready to huddle, and our chief nurse is in white there. Basically joining the huddle, hearing them, engaging in the conversation. So participating, observing, and connecting with the staff, asking questions, engaging in questions. And what's most awesome here is just the connection. Obviously, this is when there's that human to human connection, which again has been challenging in COVID. It actually is the place where people feel energized, helps us kind of focus on our purpose. And then in the one-to-one session with the manager of the OR in this situation, the executive leader and the OR director talk about how that went. What could we do? How might we tweak it? This might be what you want to do. So again, the executive plays coach role in helping us continue to look at behaviors and improving and continuing to improve staff buy-in, staff engagement, staff problem solving, staff asking questions, and staff ownership. So very, very important there. When we got to values and principles, so one of the great things about when I joined this organization, again, it was open a year before I joined, so I can't take credit for any of this work, but the organization was built and opened on the values of SRMC, working with Ann Rhodes, who many of you may know. She was a regent for UNM. She owns a company called People Inc., and wrote this book built on values that the SRMC organization focused on when it started at the hospital. And SRMC values, those listed here, are part of every single thing that we do. It's part of how we hire, it's part of how we recognize, it's part of our evaluation system. So values were already here before we started this lean management work. So we did not want to throw that out at all because it was working well. It also, I think, produced the culture that we were looking for from the very outset within the organization. So that was incredible. And again, what I'll take you back to is, again, the principle slide. Okay, so here were the principles. I've shown you the values. And what we did was we said, we want to maintain the values. We understand these new principles. Whose role is it, manager, leader, frontline, executive, to function with, or to basically ensure that the value is being aligned to the principles. So we did kind of a cross map. So values, principles, you see the align, enable, and improve, and who's responsible. And then we looked at who's going to do that. And we kind of highlighted to make sure that we understood how we would make connections. The next thing that we did was then we started to think about key behaviors. And again, this is probably the hardest work because it seems like it's obvious, but it's really not that obvious. So that in this depiction of an iceberg, the behaviors are what we see at the very top, but it's what's below that is hidden. So we don't see the processes, we don't see the systems, we don't see the principles, but it's those principles that are anchoring us to get to those behaviors. So we kind of use this visual to start to help us with identifying, well, what are those key actions? How do I want to see it? And I will show you an eye chart, but I don't expect you to read anything. It's only for visual look, but this is what we did: principles, values, and then we started to define behaviors. And we got very focused on, for example, leaders are seen in all work areas and departments on a routine basis, encouraging global thinking and sharing. So that was a definition of how we wanted to see excellence and how we wanted the leader to be assigned to that. But we eventually evolved past this, right? This was not something that we wanted to have people recite and understanding 85 bullets. So then we came up with visuals. Our marketing team helped us kind of condense it a little bit further. And so we came up with leader behaviors, aligned again to some of our key focus, manager behaviors, and frontline behaviors. And we've evolved this even further so that it's a simpler tool for people to look at. But we did want to have visuals that helped us understand that work. Then I mentioned our purpose. And in developing our management philosophy, when we started the work, we were asked by our consultants, well, what's your purpose? And we started our vision statement. And, no, that's not your purpose. Why do you exist? Well, so we had this huge epiphany. We didn't have a purpose statement. We didn't have our why. We knew we were a hospital. Okay, we want to provide healthcare, but why? Why do you want to do that? We did a lot of digging into Simon Sinek, which I'm sure all of you are familiar with his work on the why, the circle of why, and then focused back on our pillars, our true north. These have been embedded again within the organization and the health system for a long time. And we knew that, we want to get to our true north. So how do we get there? It's developing that sense of purpose. And our purpose was putting you first by providing the best environment to grow, learn, and heal. And so we ended up landing on that as our purpose statement. Again, marketing helped us create a visual, and we showcased that then not just internally, but also externally. The marketing team helped us take that one step further with external billboards that were out in the community, internal posters, the very large posters that we have mounted. The first round was this, putting you first. We interviewed and talked to several providers and staff within the organization. The next one was, how do nurses put patients first? So we really started to focus on that message of putting you first. And then through our Gemba walks, we were looking for behaviors, and also just making sure that we were focused on those key behaviors. So I mentioned that we evolved the graphic on behaviors a step further, and this is where we've landed. This is our most latest rendition, and I'll explain it to you. All the principles that we've been talking about are on this exterior circle. All the key behaviors, we've kind of condensed it down to what's the one thing that we want people to do, we put outside of that circle. We left our values so that everyone understands this is all anchored to the SRMC values, our purpose of putting you first, and the triangle that now you're familiar with, align, enabling, and improving. And again, leaders are responsible for aligning, managers are in charge of enabling, and frontlines in charge of improving. So I tried to create this visual. These are posted throughout the organization. And again, really trying to help our teams understand. So from a frontline perspective, what does that seek perfection look like? We want you to be relentlessly improving, not just fix it once, but go back and look, is it giving us the same results? Could we tweak it? Could we make it better? Is there standard work that needs to be refined if we're not getting the same results? Speak up. Don't not speak up if you see a problem, let somebody know that there could be a problem, or when something does go awry, please let us know. Making sure that we have the customer in mind at all times. Do your scientific thinking. Don't just assume that because, Nick said, oh yeah, this is a problem. It's a problem. Is it? How do we know? Break it down. Let's understand it. And then what are the processes? Don't blame people. It's not people blaming. It is about the system is probably broken. So we have to go back and understand, is it the whole system? Is it a piece of the system? Is it this one process that has to be tweaked that's not getting us the results? So let's talk a little bit about now standard work. So hopefully, again, thinking through this, standard work is probably one of the very main components to sustainability that has to happen. And when we first got introduced to standard work as a concept, on a front line, so when I was a nurse, I get standard work because it's okay, I'm going to do this at 8, this at 9, this at 10. You have your list of what you're going to do with your patients, and it's very, it's very checklist oriented. You know what you're going to do. The higher up the chain you go, there's not really good standards for, well, so what do? We literally spent, like I said, almost a year at thinking through, what do leaders have to do? Because leaders, I don't know about you, but in my situation, like I go to meetings, that's my life all day long. I'm in meetings just like many of the rest of you. But the meeting has to produce something, right? The meeting is being done for something. There's an outcome that we want to get. And my standard work might be being in a lot of meetings, but I'm also making sure that I'm cascading information, that I'm cascading key communication, that I'm bringing problems to meetings, that we're problem solving in a meeting. I mean, that is where my life pretty much exists. So this is just kind of a high level, how does leader standard work come to be? So one, it has to be what we agree the best way is of doing work today. Don't save it for later. Obviously, the more that you keep things happening at the same time, in real time, it is very important to do that work and in a same sequence. What's the sequencing? Again, I mentioned there's key things that have to happen. For example, in that meeting processes that I was describing, this meeting has to happen before this one because this one feeds that one, and so on. Timing, ideal processes. So we're looking for here, how do we make sure that myself, my other executives are doing their part towards making sure that we're focusing on aligning as leaders, our teams, and that we're creating that sustainability and reliability as a team for our managers and for our executives. So don't, create the flavor of the month by starting rounding and then you don't ever do it again. And then people are saying, well, that didn't work because we saw them once, we don't see them anymore. Rounding is built into a weekly process. So I'm going to kind of this is just a quick sample of my work, but I have daily, weekly, you can see I have every 10 years so that when I retire from here, I can say, hey, here's the CEO's standard work to the next CEO or to the interim person. This is what I'm doing now. Make it what you want to make it, but these are the key things. It's the recipe book, if you will. But for example, daily, we huddle. The executive team huddles at 8:15 every day. We use that for heads ups, communications. It's a 15-minute meeting. Critical items, we huddle as a team at 8:30 every single morning. The entire management team meets to talk about heads up, what's the status of the hospital, key things. Hey, we're going to need this. We need help. And then we use that time to recognize people. We say, hey, we're meeting our goals today. So we go to our true north and we say satisfaction for inpatient and ambulatory. Awesome. They met their monthly targets. Today is quality and we're looking at our quality goals. So we recognize, we use it as time also then to send thank you cards, but throughout that week. And then to reflect, and like I mentioned, rounding, okay, well, the executive team is going to round every single Friday. So these are just, again, some things that we've done to make sure that we're going to get the behaviors that we want in the standard work, and again, adhering to the principles and our specific role. The next piece, again, leaders, managers, frontline, is managers have this very hard task of thinking both strategically and managing the day-to-day work. So the management role is super critical in balancing the two worlds. And having been a manager most of my career, I understand what do I have to know and how do I translate it to my staff and my team. So again, very important to making sure that we're keeping managers at the top of our mind and making sure they have information to be able to give out information. But leaders should be spending our time in the strategic area, not solving the front lines problems, and really helping to make sure the front line is focused on their day-to-day work and how we make those things happen.
And
From
yeah, we had 2 questions in the chat. They're questions that I don't know if would be better answered now or when you're done. One is, I would be curious to know, as you reflect back on the great work you've done, if there's anything that you would have done differently. And then the other one is, do you believe it has had an impact on the culture? And I'm guessing it's had a huge impact on the culture.
It has. And I will, in a couple of upcoming slides, I will talk about how it has impacted results. I'll talk a little bit about that, so if we could save it for then. But I think doing things differently, at this point, I would not have done anything differently other than maybe to speed our process up. We did take a lot of conscious time, which was hard, but this is hard work. This is a huge shift from the traditional ways that you manage to create sustainability to this mental model, because it's not typical that you're leading with, well, what's the behavior I want to see? It's the what result do I want to get? We always lead with result. So I think organizationally, we had to take that amount of time. We probably could have escalated it faster, is probably had we had the time, but we can probably talk through that a little bit more as we go as well. And then I will talk back around the how did it impact culture and also outcomes, because I think the results will speak for themselves when you see those. Visual management is a big part of our management system. Visual boards are everywhere throughout the organization, including in the administrative offices. This is a piece that has gone to the wayside with COVID. We're trying to figure out how to create virtual visual boards so that we can pull up our data and do the things that we were doing. But when we started this work, we literally practiced on paper. We organized around our true north pillars, the quality, growth, satisfaction, people. Oops, did I go backwards? Sorry about that. And this is what we did. We lined the hallway with paper. We had each executive basically sponsor one of the pillars and understand, well, what do we want to see? How is it going to look? And so we just did a lot of practice. This is one of the visual boards in the administrative office now. If you looked at it right this minute, it's completely blank because, again, we don't huddle as a team up in the administration anymore because of COVID. But we are doing a daily huddle through Zoom every single day. We have maintained that, and we're focused still on the key questions and the key measures and objectives that we wanted to hear about. But every visual board is different. And so we didn't want to be prescriptive. Each unit, as they started to evolve, developed the visual boards that made sense for them. And it needs to, again, be staff driven. So we said, we want you to at least talk about the key pillars, have a place to, hey, heads ups. What's the plan for today? Are we meeting target? How do I know when I look at your board that we're winning today, or where do you need help? So each of them have created their own strategies for how that is going to resonate with the team. The next piece that I kind of want to go through is the system development. And again, the next slide kind of produces a very detailed, very lean. This is what a system might look like on paper. And so don't look at that too much. But just to say that it includes these categories of why, what's our purpose in developing the system, what's the scope, What result are we trying to get? What behaviors do we want to see? So again, this is work we typically don't do when we're putting together a plan. The behaviors are left off. And then are there tools that we have? Do we need new tools? What's a process flow trigger? So that's just this decision tree, which again is important, but really these are the key things that we want people to be thinking of, with the primary focus on behaviors, because that's what's going to get us results. When we created our transformation map for the organization and this implementation map, we knew that we were going to have to focus on key systems. So, and key areas that we were going to have to focus on. So this first 3 months of work, when we were first engaged, we kind of broke it into, every month, what are we going to work on? So this was at an organizational level. There was, focusing on starting to do Gemba walks and starting to do huddling, leadership. My executive team had to do all of this work, creating priorities. How do we identify true north, behaviors? So you can kind of see that what we've been talking about so far is what we worked on for those first 3 months. And then we had the help of our lean quality improvement team, LQIP, from UNM Health System. And then the next 6 months or 3 months, the total of 6 months, we started to look at recognition and develop individual development plans, and Kanban boards are just ways to get organized, like what's my work today, to-do lists. How do we create tier 2 huddles, so management huddles? And then we started to really dive into developing systems, and we knew like who's going to be doing this work and where do we need help. Model cell is, we identified 3 areas in the organization basically to be our guinea pigs, to test our management system and to say, so this is what we think it's going to look like, and now we want to go test it out. So we developed these key things that we said we have to see in the management system. We want to see a visual board. We want to see standard work. We want to have coaching that's happening with our LQIP people, managers, executives. We want to see problem solving, idea sharing, recognition, and then again, huddles that are key. And so those were kind of the major anchors to our management system that we said, if we're doing this work, we know that we're going to get sustainable results, again, tied to the behaviors, and which again are key to this entire thing. So this is the very high level timeline. Again, started in October with the napkin at Applebee's. And what we did throughout that period of time over the 3 years, basically, of pulling up, doing that initial work I've just walked you through. We went live with learning areas or model cell areas. We had a retreat, and we talked about it as a larger team. We identified 3 more areas. We had another, work then on how do we create huddles? How do we create systems? We had more retreats. We created the third wave. And then finally, we got the entire organization up by January of 2018. So it was methodical. It was, again, going back to the question, anything we would have done, I would have loved to condense this down, but we actually needed to have some of the time for people to grasp, what was this work? How was it going to evolve? And for us to problem solve throughout that time. We also had a little hiccup in 2016, I'll talk about in a minute, that did impact our ability to keep moving forward. And so that was something that was out of our control and did impact our kind of progression and velocity. So True North. True North, again, is built on our principles, our pillars of growth, service, people, quality, and finance. We have metrics that we have assigned to all of that. And these are some of the results that we are seeing in True North. So quality, this is a days since last report. That's what it's called, days since last report. And these are all the quality measures that we are monitoring within the organization, very high level. The days since last is the literal days or now years that we have not had this event occur in the organization. So ulcers, 231 days as of this report. Hematomas, post-surgical hematomas, 3.9 years. You can kind of see here. This corner here, hospital-acquired conditions. These are harder. Medication errors, patient falls, other harm events. but still, you know, we list it here. We understand when they happen. These are the ones where we're really diving in and trying to do problem solving. But, you know, patient falls 147 days, you know, at this time of this report. So we know that the quality systems that we built are working. The standard work we built is working and has helped us to ensure this outcome, which we're super proud of. Service. So the pinkish here color was when we were implementing lean management, and I mentioned the hiccup earlier. In 2016, SRMC lost a mill levy election in Sandoval County that resulted in $6.5 million revenue loss to the organization, and a closure of our behavioral health unit, and it was a very, very challenging time. This is the trended HCAHPS scores that you see a lot of variation in the pink that was happening. There was a lot happening during that time frame, and this is you know, July of 2017 to you know, almost 2019 here. But the loss of the mill levy in 2016 definitely impacted a ton of things. We had a lot of turnover that happened in that time. In these particular dip areas, we had a manager outage that was contributing to, you know, again, keeping the system sustainable. So lots of variation. When we came out of kind of the got everybody live, I mentioned earlier, we started to just see huge traction. We had stability of our management team. So we filled key vacancies. I'm calling out the fourth floor, but there were others within the organization. We started to focus on standard work, standard processes. We had kind of left behind the woes of the mill levy. And what you can see here is, you know, started to see a nice progression. This last year, of course, this is COVID. This is our most recent report in December. This was our busiest time in the hospital. And so it's not unexpected that we would see low satisfaction. We've had no visitors. Patients have, you've heard, you know, passed away without their loved ones present. We're trying to figure out different communication strategies. But I know that this will bounce back up because we have sustained the 96th percentile. You know, these are percentile ranks within Press Ganey and the CHAHPS and HCAHPS scores, I'm sorry, that are being shown here. So just really good outcomes when we know that we can keep the sustainable standard work in place and have the management team to enable our staff to get the work done. People and employee, so employee engagement, one of our people pillar. Again, I mentioned the loss of the mill levy. You kind of see we were very happy, and then all of a sudden we weren't very happy. That we kind of came out of that, but this is what's happening with engagement in the organization. So out of a top score of a 5.0, we're very close to a 5.0 in the organization for both providers and our staff. So very, very important for us, and really, you know, again, proud of the fact that we're seeing that. The provider side, we again saw the outpatient is the light pink, inpatient is the providers are the darker red. Outpatient, a lot more satisfaction. There again, 4.05 score, this most recent score in November of last year. Inpatient had a bit of a dip, and we actually were working on provider coaching for this FY 2020 year and provider engagement strategies, as our UNM health system colleagues on this call know. So we had good, I think we're going to do another survey, so it's going to be interesting to see what happens. But again, for the most part, an engaged and happy workforce. COVID has been everybody's, you know, impact this year. And in a crisis state, you know, what we've tried to do is ensure that we don't forget the key principles that our management system is built on, respecting everybody's ideas through very rapid problem solving, leading with humility, focusing on process and systems. Again, this has been one of the things that we have just really had to focus on. Going back to the question, has it impacted culture? Most definitely, especially in COVID. Like, we were able to have the teamwork and the collegiality and the respect and all of these things at the top of our mind while trying to problem solve this pandemic. Was it always in place? Did people lose their temper? Did people get frustrated? Yes, you know, all those things happen. We're not walking around robotically throughout the organization. But had we not had it, again, I think we would have been in a place where we would have really tried to figure out, well, how are we going to create the communication system? We already had the communication system. We had the visual boards, we had the huddles, we had all those things that we knew were gonna help us be, successful. So in COVID, it has definitely been something that has helped us. Couple slides are left, and then we can open it up for questions. This is kind of what we've been seeing as an organization. So when I said, what are our outcomes? Have you gotten results? We've gotten recognized by CMS and Vizient and HCAHPS as 4-star hospital. So that means our service is great. Our quality scores are great. I showed you those earlier. It's outstanding. Again, the team that is I work with every day is who is making this happen. They have been phenomenal through all of it. We've received top workplaces. You can see best places to work. We've become, recognized as top-notch nurses, Reader's Choice Awards, on and on. This, these are the outcomes. These are the byproducts. We didn't start the work to get prizes and to get stars. We started it because we knew we needed to have a system that got us sustainability and sustained results. But these are the joys that you can celebrate as a team when you are able to create that culture of sustainability, within your organization. Right now, our true north, we have growth is in the red because of COVID. Our volumes have been definitely impacted. Service, like I showed you, has dipped a bit on the inpatient side in December, but finance, people, and quality are in the green. So we're meeting that. I'm going to just share another busy slide, but this is how we organize around our strategic plan, our strategic goals, our operating goals. We've built this, what is called an X matrix, to help line our strategic plan, our annual goals, our true north, what's most mission critical. And this is how we deploy strategy throughout the organization, a tool that helps us get organized. But the processes obviously are in place to ensure that as a system, we know what are the goals coming from the health system. How does that X matrix that I just showed you align for the key things that we have to get done? What are the executives doing to ensure the strategy for their areas are being focused on? How are directors translating that into their units? How are staff understanding this, their objective? What part do I play in strategic deployment and results? And then ensuring, again, that management system is part of what we're doing every single day. So this is how it all gets put together. I know that the content I just went through is ginormous. And when we worked with the consultants, they said, if you don't have a headache, you should, because this is, you get a headache after you start to think and talk through all of this together. But it's been an awesome hour to be able to spend with you. Thank you for allowing me this time and for the invitation, Dr. Edwardson. We're here. I'm happy to be able to put you first today, and I am happy to answer and open up to any questions. Thank you so much.
Well, fantastic, Jamie. I'm going to let you catch your breath and sip on any nearby drink.
Water.
One of our other panelists here today, Stetson Berg, who I must say he's out of our MHA program. Out of every MHA student I've ever had, who also owns a llama, Stetson is hands down, my best performing and favorite. Well, but you own a real llama too, Stetson. Let's be clear. Stetson, thoughts, reflections on Jamie's slides, and maybe any overlap, similarities. Or I saw a lot of note taking that I know is, hey, we need to start doing this in our organization. I might have been chatting with another faculty member here in the School of Public Administration on some best practices. So Jamie, thank you for being so transparent. I feel like you really exposed, what's beneath the armor there, and I really appreciate that. But Stetson, thoughts, reflections on some of the things Jamie has shared with us today.
I thought that it was all wonderful. I feel like a little baby healthcare executive looking at all of that and trying to get a grasp on where I need to improve and how I can leverage that. I guess as far as the role that I'm in, I am the interim director of the Center for Telehealth and have been for since 2019. So I've struggled a little bit with the ability to make some of those changes. And something that I also have to say is I'm jealous of Jamie being at the top a little bit because she gets to hopefully make some of those changes. At UNM in my role, what I have is new leadership at the medical group. I'm waiting on leadership for telehealth. We're assembling a telehealth steering committee, and I'm really excited to take what she had and try to pull it into that, because with COVID, the Center for Telehealth really blew up at UNM. We've been around for 20 years. We knew what we were doing really well. And then all of a sudden we need to multiply that times 50 and train 1,500 providers at once. So I feel like I've just kind of rolled with the punches and sort of stood up something and learned the hard way in some of those pieces. And I look forward to taking, like I said, what she had and sort of using Six Sigma and quality review processes to make what we've learned a little more standard. And I'm not sure if that's what you were looking for, Dr. Edwardson, but it feels like a hot mess, if I can say that. And I'm looking forward to cleaning it up like she's done. But I can see it gives me a little encouragement that it's taken her years to do so and that I have some time still.
That's perfect, Stetson. Thank you very much. So I have a couple of, boilerplate questions from ACHE, but I don't think we need to go to those. I'm going to ask one question for both of our panelists, but for all the participants, if you could ready your questions, because after this one and after they respond, we're dying to hear from all of you, thoughts, comments, or questions to either of the panelists as well. But my question for either of you, Jamie, I guess we'll start off with you first. One of the criticisms I often see with Lean Six Sigma approaches is the simple stress that can be induced because of we might start off with simple heuristics. I mean, at the center of your diagram, which I thought got cleaner and cleaner as you progress through, there are still 3 things. That's easy to remember. As we start to progress out, though, we start to worry about some of the 5 plus or minus 2 items I can process. The other thing, just in my experience as the consultant, is typically one of the jokes is when we see one of the Lean Six Sigma green belts walking down the hallway, everyone has an ability to scurry away very quickly. And again, it's that stress, it's the relationship of getting all of these things in the mind. Could you talk about any experience with maybe some clinical groups that are more likely to scurry away from the green belts and from these processes? Or just in general, how maybe some of the, I think one way I was gathering that you were processing this is by making this principle driven and simple behavior driven, that maybe you can mitigate some of that stress. But could you talk about some of the stress management with all of these slides that you seem to have back of the envelope ready to go, but my goodness, they did seem a bit overwhelming.
They are overwhelming. And that's why I said, don't pay attention to the, the minutia, process flows, all of that. That's the part that, yes, the lean green, black belt's going to go do maybe that work if you need that. But really, I think you're calling out a critical thing, because over the years in all of my work in doing and trying to do lean tools, people scurry around. This is different than lean tools. This is about a system, management system. So there's the slide that had the kind of the main, here are the things that we have to have: visual management, a huddling process, being able to have a communication recognition system. There were like 6 or 7 things in that slide, and I can pull it up if that's helpful, that basically are the components to the management system. And we definitely, when we picked, I mentioned the model cells or the learning areas to be our guinea pigs. We picked areas that we knew were not going to run and scurry. We picked areas that we knew would be willing to try something new, that weren't afraid, that were like, yeah, let's go do it. We wanted, that's the group that we wanted. This was not the time to say, well, let's take a high performer and a low performer and a middle performer and we'll see how it works out. We really needed high performers in that first round that could then say, okay, what's working, what's not working, how do we improve, how do we develop the next learning areas? But it was a very conscious process, because the ones that did want to run and scurry did wait till later in the rollout process. And that was conscious because we knew it's going to be harder. And I think in the clinical environment, what is so critical is, again, we're asking our staff and our providers to help us solve problems. That's the main thing of the management system. Help us solve problems. We're not going to solve the problem for you. You're not going to come and knock on my door and say, hey, I have a problem, and walk away. That's not how we're going to do things here. We want you to problem solve it. Now, if you get to a place where you need help, of course, we want to help you. But I think all of us have experienced the knock on the door. Hey, you got a minute? I got a problem. And then they walk away, and now you have a problem. And then the next person comes, I have another problem. Well, I can't fix the problem, and I don't even pretend to think that I can. So at a very basic level in the management system, it is frontline driven problem solving, frontline driven decision making, where we're able, again, frontline policy making, frontline process development, system development. That's really where we get the traction, and try, and you have to be willing to try new things, and fail, and then try again, and recognize where you had success. But if I can break it out like that, it's visual management, communication, recognition, problem solving. Those are the key things to developing that management system.
And to piggyback on that a little bit, Jamie, before we go on to Ryan's question, I did my fellowship in healthcare administration in Chicago, and I got to tour the HIMSS corporate headquarters. Actually, Phil, who is helping with this, used to work there, and Hal Wolf, their new CEO, came over, and I remember a piece of advice he gave me. He stepped in as CEO. He sent all the managers, anyone who managed, direct, anything, home. He said, leave, go away, and he had a secretary or somebody from outside the organization come and take notes. He said, if I'm the CEO and I take notes, it makes people nervous. And I met with all the frontline staff, and I took their ideas and I took their concerns, and they shaped their teams. They organized the system. They came up with the solutions. And then I had to hold the managers accountable to implementing and making sure that those things worked, and that they didn't shift it back to their idea or how it used to be. And it looked like things worked really well moving forward. So you're not the first person that I've heard say that.
Yeah, I think that, again, trying to just keep it simple, obviously, is what's most important. So you all did see a lot of the behind the scene minutia detail, and it does involve minutia detail. And again, we're changing the way we think. We're asking people to think about behaviors first. Again, that's not been part of my training or part of my work and all my years. It wasn't, well, how do we want to behave around that? That wasn't how you started conversations in problem solving. So the principles, as Nick's identifying, it's really starting with those, because those are the root. And then it's, what does that look like? And then how do we develop systems with those in mind, and who's in charge, and how do we make sure that frontline has a voice, for sure, and throughout that entire process.
Great. Thank you both. Ryan has had his hand patiently raised. Ryan, good to see you. Questions for the panel?
Everybody too. It feels like I spent a long time. I guess I want to start off with some praise, of course, for Jamie. I've been in an organization that tried to implement, or did implement, a management system, and the sustainability just wasn't there. And you've been able to get sustainability, and it's just super, super impressive. Even when the health system might have pressured you to abandon your management system, you stuck with it, and the results are there. So by all means, I'm in awe. I'm super interested in how you incorporated the strategy deployment. Would love to learn a little bit more about that, because I think that's a tremendously important aspect of strategy formulation, is you have to do something with it. And kind of related to that, I wonder if you could just kind of speak to how the management system has really facilitated agility within the organization, and maybe speak to what challenges you may still see as you guys use this system in responding rapidly to changes.
Thank you, Ryan, for your comments. So first question on strategy deployment, which I just kind of glazed over. So one of the things that we do, we have lots of different metrics that we review on a cadence, whether it's weekly or monthly, but the one that we did look at monthly is our summary of all of our operational goals. We call that an OBEA session. Again, we try to pull in Japanese terms where we want to, but it's not really important. It's just, let's review goal progress for the month. And in that session, we're looking at outcomes, and we're looking at, are we getting what we want? So the operating plan, again, is tying back to our overall strategic plan. It's a subset, obviously, of that for the year. And that's where we get into, is it red? Is it green? Is it yellow? What's if it's red and it's been red, for 6 months, why is it red? Who's the team? Who's working on it? Is there, something that we need to change? Most of the time, and our kind of our mantra here is red is not bad unless it doesn't have a plan. So if you have a plan and it's red and you're working on it, great. If you are red and it's a critical, we got to fix it tomorrow, then, to your point on agility, then we pull a stat team together and we'll say this has to be fixed immediately or tomorrow. But in most situations, we're not in that kind of a predicament. Now, COVID is a different thing, which I can talk about in agility and flipping back and forth. But I think, we consciously sit down every month. So part of our standard work as an entire management team is every month we review all the metrics. Every month we ask questions about why is it red? What are we doing? Great, celebrate the green, send out kudos and thank you cards. And just try to ensure that we're staying on task. So it is now built in every single year. And as the strategic plan gets updated and the operating plan for the year gets updated, it's now just, here's the new plan, here's the process. Do we have the reports? Do we have the right teams formed? So that thing that I mentioned with the X matrix really talks about how do we make sure we have the right teams in place to deploy and work on system development as well. What system needs to be developed? I hope that answered that question. I think your second question was around agility. So again, I think this year has been a real example of us having to flip back and forth. In March and in April, we were changing processes every day like everybody else here. And so what we've been able to really highlight again as part of this management system is the fact that we've had it in place. We could quickly go to okay, at 8:30 for management huddle, we have to go through these things. We stood up an EOC, which was a parallel, our parallel system for managing the pandemic. And that EOC has been up 334 days as of this morning. So the piece that we've been kind of trying to think through is as the EOC is coming up with, this policy has to go out tomorrow, this thing has to happen tonight, this thing is happening, next week. We have used the management system as our communication vehicle to making sure that it goes in huddle, it goes in our huddle notes, it goes on visual boards, everybody kind of knows what's happening. We rounded, instead of rounding weekly, we were rounding, like 5 times a day, 6 times a day. So we changed standard work. In fact, the visual that I showed you is my typical, but we created standard work now in COVID. We had to figure out, well, so what do we have to do to modify our standard work? Because in the beginning, there was just, as so much apprehension, so much anxiety around PPE changes and all the various things that were going on. We had to talk to people. I mean, it was, as leaders, we were on the floor constantly. We canceled every meeting, right now we still have a lot of our things canceled, but it was about communication because if you don't communicate, people make it up. Then you have rumors and all kinds of other things you're trying to deal with. So we really felt that we had to keep people informed as much as we could, and we leaned on our entire, management system for that.
And that certainly happened with telehealth. People found a way to make it work if you didn't communicate the right way to do it.
Yeah.
Great. We've got 5 minutes left here. We will happily take any questions from the group.
Jamie, I just want to comment how much I appreciated the focus you had on a long period of time and how clear that was. The bridge that you showed where you showed all the different things happening. I know that bridge. It's located just north of Page, Arizona. and I could visualize what that would be like. It goes over a steep canyon where you keep changing everything, and it's very difficult. One area that you didn't reference that I want to reference on your behalf is that you have used that same commitment to sustainability and same commitment as you've led UNMH through becoming a cultural institution that's empathetic and one that has really focused on diversity, inclusion, and health equity, and the national education you had and how you applied it. You've helped create one of the strongest organizations in our state in the focus that you brought to it. So God bless you and thank you.
Thank you so much, Ron. I appreciate that. I think, Ron, your point about change, this is a system that there is change in. So one of the key things that you do have to think through is your willingness to change. Willingness to change is hard. And I think that, we all like, if I had my standard work and I'm like, check, 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 I'm done and I go home, that's not our day-to-day life, as we know. So these are just, again, ideal state, but change is something in our environment, particularly in healthcare, that keeps coming at us, whether we're wanting it or not. And I think having something as like a management system to lean on to, quickly, okay, I got to shift here or shift there to make this happen is critical. So there are a lot of tools and a lot of systems out there. I'm showing you one today, but having a system, deciding what you want your culture to be, making sure that you have principles and behaviors at the center of that system will get you the results. I mean, we're living proof. We're a little small hospital, but I know that it would work, and it has worked. There's been shingle prizes that have been given. If you go Google shingle prizes, this is what I'm describing to you, is a shingle methodology using lean and Six Sigma and other things that are guaranteeing results. And, we drank the Kool-Aid and we believe, and we're happy to collaborate. If anybody, wants to partner or collaborate, you feel free to reach out to me. Happy to help in any way that I can. And I'm going to commit the LQIP team because Yvette Sena is the dynamo coach behind all of our great work.
Any other questions from the attendees? Well, then I want to wrap up with one final question for both Jamie and Stetson. I steal this from a podcast I listen to weekly. Favorite book? It can be management related or just fiction, nonfiction. Favorite book you've read in the last year?
Well, I'm going to tell you one of my favorite books, and it's on this system. It's Management on the Mend. It's written by Dr. John Toussaint. What I just described is what Theta Care and now Catalysis has continued to evolve as a corporation, helping health systems, create sustainability and create this good work. He's phenomenal. If you have a chance to go out and look at, just Google John Toussaint, and on YouTube, he does a great interview where he's talking about this exact thing. And it's a conversation, so it's an easy listen, and he just reinforces a lot of what I reviewed today. So I would recommend that book.
Management on the Mend.
Management on the Mend. John Toussaint. Yeah, I'll put it in the chat.
Thank you, Jamie. Stetson.
One that I liked, I'm sure none of you know this. I did an internship with Walt Disney World in Florida and went through Disney University. And one of the books that I read while I was there was If Disney Ran Your Hospital. And I thought that was really interesting because they have a completely different perspective. Essentially, Disney, if you've been there, is all about how you treat the customer and going above and beyond. And I think it was a really interesting book to see what a sort of customer service perspective is on running a health system. And then I don't remember the book, but I've read another one that was on the patient comes second. And I thought that was another interesting way to look at it. So I really would recommend If Disney Ran Your Hospital as a way to look at it if you haven't worked in customer service before, and then kind of comparing that with these other books, like I just said, If Your Patient Comes Second, and seeing how you can use all of them to kind of craft what Jamie's talking about, doing something behavior-based and not necessarily results-based.
Fantastic. Well, thank you all. Let's, if you could just briefly unmute or use the reactions key to give positive feedback to Jamie and Stetson. Jamie and Stetson, thank you so much. This was fantastic. Thank you. For those of you who have not, were not here earlier, please fill out the ACHG link for the evaluation, and we will look forward to putting together this next month. Jamie, Stetson, again, thanks so much. We'll see you all next month.
Thank you, Dr. Edwardson. Thank you all. Very nice.
Thanks, everyone.
Thanks, everyone.
Thanks, everyone.
Thank you.
This concludes our
Thank
session.
you.
Today's session is worth 1.5 hours of face-to-face education credit and will be applied to your account within 2 weeks from today. Again, please feel free to fill out the evaluation. The link is located in the chat. The recording for the session will be posted in the learning management system and with ACHE within 2 business days. Today's program is copyrighted in 2021 by the American College of Healthcare Executives. All rights reserved. Thanks for attending and continue to stay safe, everyone. Take care.
Thank you so much.